Young girl with average height and build, conscious oriented and cooperative during the examination. She has a BP of 110/70, pulse of 90 beats per minute. It's regular and of good volume. There is no radial delay. There is her temperature. She is afebrile and having a respiratory rate of 16 per minute. There is no pallor, jaundice, cyanosis, or fetal edema. Lymph nodes and thyroids are not palpable. On cutaneous examination, there is a solitary erythematous atrophic plaque present on the dorsum of the nose, measuring size 5 into 4 centimeter. The overlying surface of the plaque shows atrophy, telangiectasia, fine white semi-thin scale, and some areas of hyperpigmentation. It is non-tender and having no temperature gradient. Then on examination of the hand, there are multiple bilateral symmetrical rhythmocyanotic macules and ulcerations present on the dorsal and the ventral surface of the finger and toes. They are tender and having no temperature gradient. Web spaces are clear. The skin of the palm shows palmar erythema. Rest of the cutaneous examination was unremarkable. Her scalp hairs are coarse, dry, unruly, and of equal length. Her nails, some of the nails show blue-gray discoloration, but there is no periangular erythema, dilated nail fold capillaries, and subungual hyperkeratosis. On examination of the oral cavity, there are multiple ulcers of variable sizes on the buccal mucosa and the labial mucosa, but she has good orodental hygiene, and the rest of the mucosal surfaces were normal. On examination of musculoskeletal, there is no swelling, erythema, edema, deformity of any of the joints, and no restriction of active and passive movements. She has normal vesicular breathing and with no added sound. Her apex beat is in fifth intercostal with the normal first and second hard sound with no added sound. Abdominal examination was not done because her renal biopsy was done one day before. Her sensory system shows no sensory loss and show normal sensation to touch and pain. Then on her cranial nerves were intact, and on examination of the central nervous system, her tone, power, bulk, and reflexes were normal. Based on my history and clinical examination, my top differential is systemic lupus erythematosus.